Millions of deaths, a mysterious origin and few treatments. 5 years after the start of the COVID-19 pandemic, where are we now? The figures. More than 7 million deaths and 777 million COVID cases have been officially recorded since the first infections emerged. In reality, the World Health Organization estimates that the virus killed at least 20 million people, but it's difficult to get a precise figure due to different reporting practices around the world. The virus is still killing people nowadays, but fewer than before, thanks to immunity from vaccines and multiple infections. How did COVID originate? It's complicated. Two hypotheses have been put forward by experts. One is that it was transmitted to humans by animals. Multiple studies which analysed the geographic pattern of COVID-19 cases have traced it back to Wuhan's Huanan seafood wholesale market. The second hypothesis is a lab leak in China. The city of Wuhan, where the earliest cases emerged, is home to a virology institute, which is a major hub for coronavirus research. 1 year before the outbreak, Wuhan labs proposed research on viruses similar to COVID-19. The lack of evidence means this debate is still unsolved. What's the threat today? The Omicron variant has been the dominant strain since 2021. None of the successive Omicron subvariants have been noticeably more severe than others. The virus has occasional resurgences similar to the flu. COVID-19 is therefore still very present, even though the WHO declared that the emergency phase of the pandemic was over in 2023. How can we fight COVID? There are not many treatments for the Omicron variant. A couple of antiviral drugs and a monoclonal antibody are now recommended. The main protection is still the messenger RNA vaccine, which was first rolled out in the pandemic. More than 13.6 billion doses have been administered across the world. Although the vaccine is still recommended, global vaccination coverage remains low, according to the WHO. Are we prepared for another pandemic? Not really. According to the WHO, the main reason for this is continued inequality in access to funding and pandemic fighting tools like vaccines. But an effort has been made since 2020, particularly in terms of international cooperation. For example, the World Bank created a pandemic fund, and an mRNA technology transfer hub was set up in South Africa.